Imagine that your chest is like a small world full of special and very important details. It is not just there in front of your body. It changes and grows along with you throughout your life. Every time your body goes through a new phase, like when you're a child and growing up, then in adolescence with puberty, during pregnancy and even during menopause, your breast changes along with it. And these changes are a sign that your body is always looking out for you. Before we tell you about some signs of the breast that you should look out for, let's take a quick tour to understand what it looks like inside and out. For starters, it's shaped like a teardrop. And do you know the tip of the tear? This dot is the nipple. That place right in front of your chest. Around the nipple, there is a darker colored area called areola. This part isn't just decorative, you know? It has small balls, which are actually special factories, called Montgomery glands. These glands produce an oil that helps protect the breast, keeping it hydrated and healthy. And did you know that the chest isn't just the part you see? It goes a little to the side, towards your armpit, as if it had a little tail. That's right. This tail helps provide support and is part of the body of the breast. Furthermore, it has a crease, a kind of fitting line, right at the bottom, where the chest meets the chest. Now that you know how your chest is made and how it changes throughout your life, I'm going to tell you about 8 important signs that require close attention that may appear in it. Think of your body as if it were a very caring friend that tries to let you know when it needs special attention. He will give you little clues to let you know that maybe you should pay more attention. Let's talk about each one and why they deserve care. 1. Inward-facing nipple. First, let's talk about a sign that may seem strange, the inverted nipple. Normally, the nipple points outward, right? It's like the tip of a teardrop in the shape of your chest. But in some cases, the nipple may begin to turn inward, as if it has folded into the body. Imagine a shirt button that sinks inwards, instead of sticking out. This is the chest's way of showing a possible message. Some people are born with their nipples like this, pointing inward. And most of the time, this is completely normal and nothing to worry about. In some situations, this nipple even comes back out on its own, as if nothing had happened. However, if you notice that a nipple that has always been outward suddenly starts to bend inward, it's a good idea to talk to a doctor. It could be a small sign that something is different in your body, and the doctor will know how to investigate this and make sure everything goes well. 2. Rash around the nipple. Another sign is when a rash around the nipple or areola, that darker area around the nipple. Imagine that the skin in this region becomes red, dry, and begins to itch, as if it were an allergy or even an insect bite. Sometimes, it also becomes cracked and can release liquid, like a wet wound, and this can be very uncomfortable. A lot of people think it could just be an allergy or eczema, and that's often what it is. But if this rash doesn't go away over time, it could be more than just a skin irritation. The body uses this itching, redness, and cracking as a way to warn you that something different may be happening. In these cases, even if it seems like just a silly irritation, it is important to pay attention to this change and talk to a doctor, who will investigate further to ensure that it is just an irritation and nothing more. 3. Skin pulling, tying. Finally, let's talk about a sign that may seem less visible, but is still important: the pulling on the skin you're mooring. This pulling happens when the skin on the chest seems to be pulled inwards, creating a dent, as if a part of it was trapped underneath. It is as if the skin is tighter in one area, forming a small dimple. This pull on the skin is usually easier to notice when you lift your arms or move your shoulders, as the skin seems to trap or stick to a specific point, creating this small fold. Sometimes it's as if a piece of skin is pulled and doesn't go back into place. This is what we call binding, and it is the body's way of showing us that something may be happening under the skin, there in the tissues that support the breast. Just like the other signs, it is a message for us to pay attention and, if we notice this type of change, talk to the doctor to better understand what is happening. 4. Dimples in the skin of the breast. Imagine the peel of an orange up close. It is full of small marks or dimples. Sometimes the skin on your chest may feel similar, with small dimples or depressions, appearing wrinkled or rougher to the touch. This phenomenon has a specific name, called peau d'orange sign, which comes from French and literally means orange skin. This effect happens when the breast tissue becomes thicker or swollen, and the pores in the skin end up standing out, giving the appearance of dimples. This can happen for a variety of reasons, but in some situations, it is a warning from the body that there is a problem beneath the skin, such as inflammation or another condition. If you notice these dimples appearing in one area of the breast or even in a larger area, there is no need to be alarmed, but it is best to talk to your doctor. It's a way to take good care of your body and make sure everything is okay. Before continuing with the next signal, take the opportunity to check if you are already subscribed to the channel. This way, you don't miss any important health content. 5. Redness and heat in the breast. This is another sign that can be easy to notice. Imagine that, suddenly, a part of your breast, or the entire breast, becomes hotter, with redness that may even be painful. Sometimes this feeling of heat and redness is like a warning that the body gives to indicate that something is happening inside. This could be a sign of inflammation or even infection. In women who are breastfeeding, it is common for cracks to appear on the nipple which, if not taken care of, can be a gateway for bacteria. These bacteria can cause inflammation called mastitis, which leaves the breast red, sore, and very sensitive. But, if you are not breastfeeding and notice this unusual heat and redness, it is important to keep an eye on it and talk to your doctor. Sometimes this heat can be the body's way of indicating that it needs help, and identifying the reason for the redness is the first step to ensuring your health. 6. Nipple discharge. Nipple discharge is when some liquid comes out of the nipple unintentionally. This liquid can come in many colors, and each color can give a clue about what is happening in the body. Sometimes the discharge can be white or slightly yellowish, like milk. At other times, it may have a greenish or brownish tone. And in some cases, the liquid may even be stained with blood, which can be a little more worrying. This liquid can appear for a variety of reasons, and it is not always a sign of something serious. Sometimes it can appear when you take off your bra, and you see a small stain on the fabric. Other times, it only appears when the nipple is pinched or pressed. However, if the secretion comes out spontaneously, without any pressure, and especially if it is coming from just one of the nipples, it is a good idea to make an appointment for a doctor to evaluate it. Secretion could be a sign of a change in the breast ducts, which are the roads through which milk would pass, and it is important to understand what the body is trying to say. This way, you ensure that everything is fine and take care of any changes that appear. 7. Change in breast size. It's super normal for our bodies to be asymmetrical. In other words, having one side that is different from the other is common. Many women have one breast that is a little larger or a different shape than the other, and this is not a cause for concern. During pregnancy and breastfeeding, the breasts go through several changes as the body prepares to produce milk, and the increase is natural and expected. The same goes for some phases of the menstrual cycle, when the breasts may swell a little and then return to normal. But what happens if one of these size changes is sudden and for no apparent reason, such as pregnancy, period, or breastfeeding? If one of your breasts suddenly seems to be bigger, harder, or has a different shape, without a clear explanation, this could be a sign that something is happening in the body that deserves attention. This change may be mild or more noticeable, but either way, it's always a good idea to talk to a doctor. This type of change can be caused by a number of things, from mild inflammation to signs of something that needs closer monitoring. A professional will be able to carry out tests to ensure that everything is okay. 8. Lump in the breast. Feeling a nodule or lump in your breast is one of the things that causes the most concern, and it is natural to be aware of it. These lumps are often benign, i.e., not dangerous, and may even be part of the breast tissue itself, especially in the weeks before menstruation when the breasts become more sensitive and full. Some nodules may feel hard, others softer. Some are smooth and can move when touched, and others feel more fixed. Therefore, the ideal is to check your breasts a few days after the end of your period, as this is when they tend to be less sensitive and less swollen, making it easier to feel any difference. If you notice a lump that is persistent, that is, that does not disappear over time or with the end of the menstrual cycle, it is a good idea to talk to a doctor. This includes not only lumps in the breasts, but also lumps or swellings near the armpits or collarbone, as these areas can also give clues about the health of the breasts. These signs don't always mean something is wrong, but in some situations they can be an early warning. Keeping an eye and talking to a professional is the best way to take care of your body with care and responsibility. So, if you notice any of these changes, take a deep breath. There's no need to worry. But don't ignore it. Book an appointment to clear up your doubts and take care of yourself. If you've watched this far, congratulations on taking care of your health. Don't forget to subscribe to the channel for more valuable tips on health and well-being. And if you liked the video, leave a like to help us bring more content like this. Until next time.